You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, no more dentures. According to my first guest, he says nobody should be wearing a loose-fitting denture. We're talking about dental implants today. And with us, we have the founder of the go-to place in the desert for dental implants. It is Coachella Valley's premier center for implant dentistry. With us, we have Dr. Shah. Dr. Shah, welcome to the program.
Thank you, Randy, for having me on the show today.
Okay, good. Now, for people that don't know your practice, you're right there on El Paseo.
Right.
Who's the typical patient that comes in for dental implants? And also, I understand you do kind of everything there.
Yes, we're a comprehensive office. We do everything from fillings to extractions to veneers and composites and crowns and dentures. But what we pride ourselves mostly on is taking care of our patients that either need implants currently and are in dentures, or are heading that way in the near future and losing their teeth.
Are there a lot of people in the desert? Because we talked at the top of the show, no more dentures, no more traditional dentures. Are there a lot of people in the desert wearing a denture?
Hey, Randy, you would be really surprised. You could probably fill up 10 of our tennis gardens in the desert with people that have upper or lower dentures. So it's a big problem that
right?
we're trying to address, yes. So, and the people that are heading into dentures is an astronomical number. If you look at it, 120 million Americans today are missing at least one tooth, and that's projected to increase to 200 million over the next 15 years. And some statistics show that over 40 million Americans have an upper or lower denture. So it's a big problem.
So it's a big problem. Now, if dental implants are so good, right, to secure a denture, right, or to replace missing teeth, why aren't they all doing it? I mean, there's so many denture wearers. What's your take on why they're not coming in to do it?
So my take is there are multiple reasons. Number one being is when you're a denture wearer, you stop going to your 6-month recall appointments that we recommend as general dentist for having a perfect oral health over the years. So when they do go, it's because they have a problem, something is bumping, they have sore spots, they're already frustrated when they get there, then they are complaining about the cost of the reline. And next thing you know, they're very frustrated with the doctor who's trying to help the patient. So they don't get the options. That's very important.
So they don't know their options.
They don't know how we have advanced in technology and what we're capable of today. That's one
because they don't go to the dentist.
Correct.
Okay,
they're out of the
point.
system. They're not in a recall system anymore. And another reason why denture wearers don't want to come to the dentist is because of the background in the past. Put yourself in the shoes of a denture wearer. They've been to a dentist multiple times. They have had extractions, they have had root canals, they have had fillings and crowns, and at the end, when all of the teeth are taken out, they have the sense of a feeling that it's over now. They're relieved. There's not going to be any more pressure for them to go to the dentist. And a third problem is the price. We have 32 teeth in our mouth, and if you're a patient that didn't get the options that they could that they would be privy to get the care they need or want or seek, you do not know that 4 or 6 implants might be able to replace 12 teeth.
So you could do a whole arch of teeth on just like 4 or 5 implants?
Yes, and you don't have to replace every one of your 32 teeth, which becomes an exuberant cost that most can't afford. I probably can't afford that.
Okay, all right.
So that's important to know what can be done with their situation. And the third is being pain. You know, I can't tell you how often, Randy, I get done with an implant procedure and a patient tells me they didn't feel anything and it was easier than a filling or than a crown, which are the most simplest procedures that we do as dentists. So we have to educate the patients and sit down with them and explain to them the entire process. And once we pass that apprehension, it's no longer a limiting factor to get what you need.
Now look, some people feel more pain than others, but you're doing sedation, you're numbing the patient, so they don't really feel anything during the procedure.
A lot of times they wake up and they don't know what happened.
So you do IV sedation, oral sedation, different levels of sedation?
So there are 4 levels of sedation.
Okay.
You know, the easy stuff, the cleanings and the fillings and so forth. If the patient requires an anxiolysis, what we call nitrous oxide, they come in, they have a good time, they laugh a little bit, we laugh a little bit, and we get the job done. And then there's oral sedation where we give them a pill. It could be Valium or Halcyon or something of that scenario that they take prior to their appointment, which sort of is a part of the conscious sedation scenario where they're still awake, but yet very relaxed and calm. So with these more complex cases or full arch cases, we have the option of IV sedation. And a lot of the patients, I can tell you, they report back to us and tell us that they didn't feel or anything, or they don't even remember. They woke up on somebody's couch, and essentially they are...
somebody's couch, meaning the person that gave them a ride home.
Precisely.
Right?
You have to have a ride home with someone, correct. And it is very rewarding to see that happen for patients when they come in, they go to sleep, they don't remember anything happened, they don't feel any pain, and then they wake up to a beautiful smile, life-changing smile.
Okay, how soon can they eat? So you take somebody maybe that had a denture, and now you fix a full arch of teeth with dental implants. How soon can they eat?
They can eat the same day when they leave the practice, which most don't believe us. But again, with our accuracy and the way we do procedures now, the tools that we didn't have before, like guided surgery or CT scanning and immediate loading, we can a lot of times get the patients to walk out with the teeth and eat the same day and start the first day of their new lives.
Okay, good. We're going to take a quick break. We come back, more about the dental implant process, what people can expect. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
Desert Dream Dentistry and Spa on El Paseo offers patients meticulous, personalized, one-on-one attention, cutting-edge technologies and latest techniques, cosmetic smile makeover procedures and spa services, aesthetic dental implants, and sleep dentistry to dream your dental anxieties away.
Welcome to Desert Dream Dentistry and Spa, where your dream smile awaits.
Welcome to Desert Dream Dentistry, where your dream smile awaits. Desert Dream Dentistry and Spa offers meticulous, personalized one-on-one attention, cutting-edge technologies, and latest techniques.
I had discomfort in a cracked tooth, so I called Dr. Shah. I came in a couple hours later. He resolved the issue and put a temporary in. Technology is paperless, and you see everything within seconds as soon as it's done.
Complimentary Boost Opalescence in-office teeth whitening for qualified new patients after exam, x-rays, and healthy mouth cleaning.
You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. He is the Desert's premier center for implant dentistry. We have Dr. Shah. Okay, Dr. Shah. Now, age. How old can you be to get, like to the denture wearer or the person with really bad teeth? How old can you be to get this done?
There's no particular age limitation. You had asked why people might not get this procedure done. A lot of them self-diagnose. They go to a dentist that has rather 2D technology and tells them they don't have enough bone, and that's the end of them. That is true for that doctor and the technology that might not have the experience, but we rarely ever, that I recall, had to tell a patient, you don't have enough bone and we can't do anything for you. There's always something we can do for the patient.
Okay.
So age, I had a 95-year-old patient.
95?
Yes.
Why would they want to get dental implants?
Because they want the same thing as you and I want.
Okay.
They want to smile, they want to laugh, they want to go out with their friends and eat, they want to go to bingo, they want to have their grandkids at their retirement home. The same exact reasons why you and I like to have nice looking teeth. Yes. And self-esteem and confidence is very important for any human being.
Now, when you're out and about in the desert, can you see, can you spot people that don't like their teeth?
There are telltale signs. I mean, if you see a patient that is laughing and holding their hand over their mouth, that could be something that is that they're hiding, essentially.
All right.
They're not coming out with their own self, the true self. So yes, I can spot them. You got a guy in a room that is smiling, laughing. That person shows charisma, and that patient looks healthy and happy and excited. And that's the state we would like to get our patients to, because it changes their lives.
It really changes their lives?
Stories every day. We hear those stories every day. Yeah, let me tell you about that patient I was telling you about that came in. And she was extremely apprehensive of the dentist. So she canceled on us the first time, and then the second time the caregiver brought her in, and we had a chance to actually have a discussion with the patient.
Okay.
And once the patient understood what their options are, and understood that age is not a limiting factor, and a little bit more back and forth, she started the treatment with us. And now she comes in for her follow-up. She's happy, she's got lipstick on, she's bringing cookies for the staff, and you can just tell something has changed. And it's something that we strive to do. And at that moment, I realized this is what I really wanted to do for the rest of my life. I wanted to get that kind of a feeling to every patient that walks through the door, and something wonderful has happened over the years that these patients that I treat become very close friends of mine. Some I ended up doing other activities with, and I ended up engaging with in other things that make life pleasant.
Okay, good. Now, in your office, I guess the way dental implants are normally done, correct me if I'm wrong, is you go to one place that does the surgery. You go to another place that puts the teeth on top, and another place that does the imaging. I guess you do it all right there. Aside from convenience, what's the benefit to the patient?
Aside from convenience, it comes back to, for example, one of the limiting factors that these patients don't come into our practice for is the price. If you have to go to an imaging center and to an oral surgeon and a prosthodontist and end up, the bills rack up very fast. So the stories that are out there sort of make the patients afraid, just kind of like the needle stories that are out there. But at the end of the day, if you have everything in-house, you can save the patients a lot of time.
So you do everything. You do that. You've had a lot of training in the surgery?
Absolutely. I've been engaged in this field since 2008. We have trained a lot of doctors in our academy. I teach it. I learn every day, and I try to make myself better in this art of practice of dentistry. Yes.
So what about gums? Like if you have bad gums, the bleeding gums, the bad breath, as you guys call it, periodontal disease, can you do this? Can you still get implants?
Absolutely. Most of the patients that present to our office have bad gums and periodontal disease, but that's because there's a bacterial infection that adheres to the teeth and likes the teeth. So if you don't have the option of saving those teeth for them, when we remove the teeth, the gums heal to a nice pink and they're ready to have the implant treatment rendered to them, if that's the case for that particular patient.
Now, you say that people could literally, with bad teeth, could come in, you could do extractions and give them their dental implant teeth, and they could leave the same day. Is that true?
Yes, it's very true. With the latest technologies and guided surgery and CT scanning, it's very possible. But sometimes, for some patients, the treatment might take a little longer, might be a little bit more complex, but we can always get them to the end result that they seek.
Are they ever without teeth?
Never without teeth with us. There's also, if we have to do a longer procedure, we have different ways of making sure that they maintain their teeth for everyday function.
Now, in your bio, you said you like saving teeth, that you, in fact, were the root canal guy, like traveling to dental offices, doing root canal, saving teeth. So how does that help you with the implant patients?
Well, the best thing you can possibly have is your own natural teeth. So we have to do everything we can as dentists to preserve what you have. An implant is sort of the next best thing to have versus all the other options such as bridges and dentures and so forth. So it's becoming rapidly the standard of care that you don't go after two adjacent teeth that are what we call virgin teeth often, and you shave them down and you bridge something that patients can't floss under and have to clean under. Okay. So first thing is to preserve the best you can, be conservative, and if you can help save the teeth, we save them before we even consider an implant scenario. But our philosophy has changed now. When we can save a tooth and we take it out, we think ahead in time, what can this patient in the future get and how do we preserve that bone for that patient so the patient might get an implant down the road or be bone graft. So back in the day we didn't care. We took the teeth out and we said, hey, it's over. Now we care. Now we treat patients differently. We think ahead of time. So whenever we can save teeth, it's important for us to act and save the teeth. All right. But when we can't save them, we take them out, and now we have the option of an implant, which is the second best thing to natural teeth. Okay, good. Now we're going to back up for a moment, because at the top of the show we said no more dentures. You think you can wipe out dentures in the desert? To wipe out dentures in the desert? Where nobody's a traditional denture, no more. Yes, so in the course of the next 20 years, if I keep doing more and more cases and helping people, which I love to do, we might get close to that, but that's going to be a lot of work. Now, I know a couple denture wearers, okay? And they never complain. They seem like they're fine. Are you saying there's no such thing as a happy denture wearer? Randy, they're not going to complain to you. They're spending most of their time trying to hide that they have dentures. Okay. They're married. They're trying to figure out how to hide their dentures so their wife never sees them with a denture in their mouth. They're constantly wearing glue which is a multi-billion-dollar industry that they're not happy about. And to clean that stuff and get it off, I imagine it to be a very annoying activity on a daily basis. And then you got these guys that don't go out and make up excuses about why they're not with their friends and they won't go to dinner because they don't know if the denture is going to fly out in the middle of a dinner or if they have to run to the bathroom to clean it. So they don't.
They tell you this on the consults, like they're insecure about their teeth?
Well, the patients tell us that after we get to know them a little better, but the opposite reason they will never tell you that they have problems with their dentures because in the first place, they're trying to hide it. A lot of the 80, 90-year-olds that you mentioned earlier, they're still, if you believe it or not, they're still in the dating game. They are in Match.com, they're going out. So when they have something confidence, when we give them a confident smile, their charisma comes out. When we give them the teeth back and they look in the mirror, they realize not only does their inner smile come out, but they realize that this is the first day of their new life.
Good.
So yes, sports is also another issue. For example, have you ever tried, or do you have any concept of what it would be like to play tennis with a loose denture? Or,
I guess not good, yeah.
Or go out golfing or skydiving and all the things that retired people like doing that they have all the time for, but are not doing because the real reason is they don't want to go out, they won't want to run the risk of being embarrassed in front of others.
Yeah, now, so they're never left without teeth during this process?
Never.
Is that right?
Never.
Okay.
So from the time they come in, intra-procedure, during the procedure, and also post-procedure, they will always be with teeth for us.
And do they look real? Because I feel like I could spot a denture.
I can tell you in the office, it's sort of a joke on who's going to get the mirror to the patient first after we deliver the dentures. Because the teeth and the gums are so beautiful, and the patient opens their eyes and they're shocked and they choke up a little bit, and you're standing there, you choke up a little bit, and then it's the most beautiful feeling that you can possibly have when you satisfy another human being. And that's what heroes look for. That's what they get accomplished. So essentially, us as clinicians that are doing this for other people, some consider us as heroes from time to time.
Okay, good. I have to ask you about the options for denture wearers. Okay, so the two groups, people that you can't save their teeth, the teeth need to be extracted, and then the denture wearer. What are their options when they go to your office when it comes to dental implants?
So they have the simple options of having a few implants put in and a denture that snaps on and off.
Okay.
Which is much better than having the glue.
What can they eat with that?
They can eat about anything. I've had stories about people eating carrots, biting into apples. The ones that like corn on the cob, they eat corn on the cob. So it really...
like 2 or 3 implants on the lower, get a lower snap-in denture.
Get a lower snap-in denture, yes.
Okay, no more adhesive with that?
No more adhesive with that. That's eliminated in your life.
Okay.
That's the snap-on and snap-off option, where if you have 4 or 5 or 6 implants, you get a little bit more stability. The next option is to have 4 or 6 or 8 implants and have fixed teeth that do not come out. So they never come out.
And that's a full arch of teeth, supported.
Full arch of teeth, correct.
Okay.
Supported and fixed, and only we can take it off for them from time to time to clean or have follow-up appointments, make sure everything is going well.
What could they eat with that?
I've had all sorts of stories from patients that range from nuts, certain nuts that they like, to eating salads again and chewing that cucumber and then biting into the apple and biting into the corn on the cob. So lots of different stories. I had a patient that came in that we delivered a full arch fixed teeth for that patient, and that patient showed up for a follow-up appointment and asked me if they could eat corn on the cob. And I was surprised by the question because it was a bar-supported denture which you can't break. And I responded, you can eat anything you want. And surely enough, a couple of days later, he called me, he had a nice steak, he went out with his wife and had a beautiful time. And since then, he's everything that he likes and enjoys, which makes him healthier, which the doctors that he visits also want him to do.
Now, what about the upper denture? I guess there's suction, so the upper denture is fine?
There is suction, but let me tell you a little bit about life of a denture wearer before they got to this stage and what they're doing now. When you're eating with dentures, you're not really tearing like your front teeth are designed, or chewing with your back teeth like they were designed. You're just sort of rubbing the food together and swallowing it. You don't enjoy the taste of it, the spices, the salts. That's all gone because you have a big thing on the palate that causes
the plastic on the roof.
Plastic.
Okay.
So humans adapt to plastic. After a while, they don't complain anymore. But the fact of the matter is that it's all covered up. So when we give them the upper teeth, they're designed in a horseshoe where the top roof of the mouth is not covered at all. So now we get the same response all the time from patients, that they can taste their food, they feel the hot and cold, they feel the spices. And that's also the whole purpose of being able to enjoy a meal, besides the nutritional needs that
we were talking about a little bit earlier, and I think I interrupted, but dating. So if you're dating and you have a denture, you're in your 70s or 80s, it's probably embarrassing, right? You got a little bit of a secret going on. How do you tell the other person I have a denture? You
normally don't, and you do have a secret. It's very tough to plan around all of the activities you have. And a date can go really sour if for some reason or another you have problems with your denture during it. So people hide it. They'll hide it the best they can.
So there's a lot of people with bad teeth, you know, I guess everywhere, right? And we've talked in the green room that people with bad teeth are judged. Elaborate on that.
People are, you see a picture of someone that might have cavities and broken down teeth, you automatically assume they're not brushing their teeth, they're they're poor, they're not very sociable people, they wouldn't do well with you or your organization. It's just human nature. But when you see a person with a big white smile that brightens up the room, you sort of approach that person differently. That's inherently in us that we can't change. But the fact of the matter is that person is still the same person. Look at what Hollywood does. When you see all these action movies and all of these comedies, you see people with white teeth. But the villains and the poor ones, they make them dress differently. They give them different sort of teeth, broken up, gray for the villains. Yeah. So there is something we can learn from that. Your smile, your whole body is covered up. All we see is your eyes and your smile. And if you look at the research, it's usually smiles being number one, and there's always a little, at times, you know, you have the eyes, people notice your eyes more than your smile, but the vast majority of the research shows. So it's not a point to contemplate. People look at your smile and they judge you based on your smile.
Well, you're a dentist. Of course, you think the smile is probably the most important thing.
Well, it's not really what I think, it's what research shows. Think about it, Randy. If you had a job interview right now and you had two different individuals there, one smiling,
like two twin sisters.
Two twin sisters.
Same background and training.
Let's say all variables equal. One is smiling and the other one is not. You're looking at that person and you realize the one that's smiling, that's not the factor that you're going to hire that person for, but you're looking at the smile and you're thinking to yourself, this person is happy. They're ecstatic to be here. They're going to do they're going to be great addition to my team. And they're with it. And then you don't have the same impression of the other one. So I would suspect you would hire the one that's smiling more. Wouldn't you agree?
Yeah, that's fair to say. You hire the one that looks happy and well-adjusted and positive. So you see it. There's so many people that don't like their teeth. And is it the fear of the dentist? You know, we've already talked about why they don't come in. But there's a lot, I mean, do you hear that still? Like, no offense, doctor, but I don't like coming to the dentist? Do you hear that?
No, especially when they're at that stage with what they have gone through. Let's take a look at what they went through before they ended up in my chair. All their young years and all the adolescent and early 20s and 30s, they went to a dentist. They kept up with their appointments with the promise that they're going to be okay. And then the problems became more. The root canals, the fillings, the crowns, and next thing you know, they realize that they're going more to the dentist than twice a year. And they're not getting out of it what they want. So at the end, when they get to my chair, they're happy that they don't have to do that anymore.
Okay.
But they don't know their options. So once I still truly believe that patient education is the most important factor in this process. Once the patient knows exactly how easy it is and how it might change their entire life, we get a completely different response from our patients.
So once it's all done, they just come in for maintenance like every 6 months?
Yes.
It's just like regular teeth?
That's right. Every 6 months we see them, they come by, usually it's a very quick appointment, and they're always happy. It's just, here's a story I'll tell you about a lady that I had in that took me a long time to convince to get this procedure done. We went in and gave her a full set of teeth, fixed, and she walked out of our office, very excited, started leaving some great reviews for us, but then I noticed something very peculiar. Every time she came in for follow-up, something had changed about her. Her hair was out, nice and blonde. She was working out, taking care better of herself. She was eating better. She was happy. Such a glow in her face.
All right.
And we hear these type of stories all the time of patients that come in, they're excited, and something has changed about them. Changed life and experience for most.
Now we should mention Medicare, Medicaid does not cover this. Even with the best PPO insurance, only covers a very small portion.
Yeah, but there are financing options, Randy, for these patients. And there are multiple different ones to meet your financial budget. So a very reasonable monthly payment on some of these cases, some $100, $200, some more, some less, depending on what the patient needs. But there's certainly options outside of the insurance realm for patients with us. And we can certainly stage the procedure. If finances are low and the financing options are an option for the patient at this time, we can focus on one arch or the other arch to at least get them to later upgrade to what they seek or want.
And so they could start with a snap in, snap out. I told you this happened to my father.
Oh,
right?
Yeah,
Started with a snap in, snap out. And because he was watching my show, he said, my denture's fine, my denture's fine. He saw one of the doctors on my show and he said, I'll talk to the guy. Now he's got a full arch of teeth on the upper and lower. He's 82 years old. He eats whatever he wants. He plays the trumpet. He even is under the impression that young girls like him. And I said, Dad, no, you're 82. You know, just because they compliment him on his smile all the time.
Sure.
But that's common, right? You know, they get their new teeth and...
The compliments, yes. And also, patients coming in and having one arch done suddenly say, hey, I'm so happy about this arch and it doesn't match the other one. I want to start looking into that type of treatment. That happens to us a lot as well. So it's a marathon, not a race. We can eventually get you there, but you have to take the first step and find out what your options are.
Okay, good. And I told you at the top of the show, when somebody asks me, you know, who's the implant guy of yours in the desert, I say Dr. Shah. In fact, I said it today. I said Dr. Shah is the, you know, for dental implants in the desert. And I'm trying not to endorse you, you know, but because of your training and things like that, you know, I would send people to you. So.
I really appreciate the confidence, and I have spent my whole life training and getting to this point where I can care for these people.
Okay, good. I want to thank you for coming on the show.
Thank you for your time.
Good. All right.
Appreciate it.
You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.